So pleased and honored to have you all here today. You're going to hear a lot of thank yous from many people today, but I want to take a moment and tell you how much I appreciate all of your support. And I admire all of you greatly, and we are just so grateful for your support of our hospital. And right now, I'm going to introduce Kathy Fisher, who is the chair of our board.
Thank you, Leslie, and thanks to all of you for being here to celebrate. It's taken a long time to get here. As you know, COVID threw our construction timeline for a loop, but we're finally here. We finally have the emergency department facilities that our patients and our providers deserve. And I want to give a special thanks to start with for Joanne Conroy, Dr. Joanne Conroy, who is CEO and president of Dartmouth Health, and to Senator Peter Welch. We really appreciate them being with us today because we are so truly thrilled to be celebrating the opening, the completion of the new Kendall Emergency Department, the Richard and Pamela Ader Lobby, the Jackie and Tony Marrow Cafe, and the Stout Thompson waiting area. I think we deserve to clap right here. And I have to express our deepest gratitude to the significant donors who really led the charge in making this happen. That's Don and Nancy Kendall, Susie Hunter and Doug Watson, Pamela Ader and her beloved deceased husband, and our beloved board member, Richard Ader, Jackie and Tony Morrow, Cindy Thompson and George Schmidt, Concy West, and other wonderful friends whose names you will see on the boards inside and outside the lobby. So many people were so incredibly generous, stunningly so, because they saw the need for this critical initiative and they made it happen. And for that, I cannot express how grateful we are. I also have to give a very, very special thank you to Tom D, because his vision and leadership on this project and everything else at the hospital is what made it happen. Tom's commitment to SVMC and to the community are really what let us successfully complete this phase of Vision 2020, a decade of transformation. As most of you know, the Vermont Chamber of Commerce recently named Tom the 2024 Citizen of the Year, and no one could deserve it more. So I'm very proud and honored to now introduce Tom D., President and CEO of Southwestern Vermont.
Thank you, Kathy, as always. And I'm not sure all you know, but Kathy, who's been our great board chair, her term is ending as a board member after 9 years, which is our policy. And so September is going to be her last time chairing our board. I just want to thank her really from the bottom of my heart for what she's done in those 9 years, which has been incredible. Her leadership's amazing, and both her and Rocco have been incredibly generous to our healthcare system. So thank you, Kathy, for everything. You know, it just seems like yesterday that we all gathered here 3 years ago on August 21st to have the groundbreaking. And it's amazing. Similar type day. There's a little more comfortable today. But I want to really, on behalf of the entire SVMC family, I want to express our sincere appreciation, certainly to Don and Nancy Kendall, but all the rest of you who are here today who've been incredibly supportive and generous on this critical project. You know, a case can be made that emergency services is probably the most important services for a community hospital. All of us use our emergency services. We see about 25,000 patients a year here. And the transformation of our emergency room, our patient registration, our main entryway and lobby space will really have an impact in our community for years to come. And we're very, very excited about this beautiful facility that you all have a chance to see later on and make some tours of. But let me express my sincere appreciation really to our volunteer leaders, our board, of which many members are here today, our foundation board led by Dr. Keith Michaels, who's here, and other foundation board members, and our regional advisory boards. We have over 60 governance members who are involved in our healthcare system here. And it's really due to their steadfast commitments in work and support and generous support that we're all here today. I also want to make a special note of appreciation that goes out today to our facilities team. I see Ron Zimmerman back here, who's been our leader of facilities, and his team working with all our construction partners. We have PC Construction, who is our general contractor and construction manager, LaValle Brenziger, who's our architect, Skanska, who's our owner project management rep. All of them working together over 3 years in a very challenging project. This was realized half of this is new construction, but half of it is renovated space that we had to care for our patients during this the past 3 years. And I'd be really remiss if I didn't acknowledge the work of our emergency team that's here today. You see them over here in the purple. Led by Jill Maynard, our nurse administrative director, and Adam Cohen, our medical director, who were very involved in the planning of this project. But this team did an amazing job. They participated and they worked in a very busy department under 3 years of construction. And it's been amazing. And despite all that, just recently, they were named the Lantern Award winners for emergency services and nursing care. And that goes to the top emergency rooms in the country. And there's only 75 winners of that across the country, and we're the only one in Vermont, New Hampshire, and all the capital region of New York. So I want to acknowledge their job. And of course, another team that's been instrumental here behind the scenes, but pulling us all together and making this a reality, is our corporate development team, led by Leslie Keefe and her team of marketing and foundation. They've been working tirelessly to make this project happen, talking to many people, and it's been an amazing show of community support that we received, but they also did an incredible job. So thank you, Leslie, and your team. And of course, these type of transformative projects couldn't happen without the local and state and federal leaders. And we've had great communication with our local leaders. I know a few are here today, Mary Morrissey and Mike Rice, and I think Tim Cochran's here, Tim. So thank you for your involvement. I want to thank Beth Stern from Senator Sanders' office. Beth's here over here. So Bernie's always been in our corner and helpful. And of course, having Peter here, Peter Welch, come is tremendous. Thank you, Peter, for making the time to be here today. And you should know that Peter, working with Bernie, have been incredible in terms of a number of key projects. And our next major one will be our cancer center. So Peter, thank you for what you've been doing, too. And finally, we're very fortunate to have a great partner in Dartmouth Health. Joanne Conroy is here today, as Kathy indicated, and Joanne has been great to work with. She's a true leader, ally. She's here all the time when we need her. And it's been 1 year since we actually had our integration with Dartmouth, and they've been great partners, and we're very excited about going to the next level of care here. And so Joanne, thank you for all your support, and I'd like to have Joanne come up and say a few words.
Thanks, Tom. It's really great to be here. I love coming to this area, I did make my obligatory visit to the Village Chocolates, which opens at 10 a.m. And I always make sure I have enough time in my travel schedule to stop there. As Tom mentioned, I'm Joanne Conroy. I'm President and CEO of Dartmouth Health, and it's just great to be here to celebrate with Tom and Kathy Fisher. Your board chair, soon to be drawn into our system as a representative of our member organizations at the Dartmouth Health System. So poor Kathy thought she was done with board leadership and healthcare, but we just grab you and continue to pull you back in. But she gives us an incredibly important perspective on some of the stresses and strains that all of our members face in the rural communities, as well as an incredibly impressive background that will help have us think very differently about, how we finance and support everything that's going on across Dartmouth Health. It was nice to see Beth Stern again. I think we've been here at a number of groundbreakings, and of course to see Peter Welch, Senator Welch, who just lives across the river from me in Norwich. But the important thing is to celebrate the transformation of this space. I was here at the groundbreaking. I think I was here when we celebrated maybe the lobby. It was every single time I come here, I'm just so impressed on the progress that's made in the physical plant, as well as the team that's working in the middle of construction. And just watching how the emergency room actually moved their services from space to space to space to accommodate the continued construction was very impressive. And we only have 35,000 visits a year at the medical center. So 25,000 visits a year here is not insignificant for the size of this community, and it tells you how important the emergency room is. It is the front door for many people in this community. At the medical center, about 40% of the people that come to the emergency room get admitted. And I'm sure the numbers here are probably very similar. High acuity patients are actually showing up in our emergency room every single day. I want to comment a little bit on our fantastic partnership that we have with SVMC that began back in 2012 when we started to work together on cancer care telehealth and the Putnam Group. And then it set the stage for them to become part of our family last year. And we're just honored to be here as a member of the family. I have to say, Southwest SVMC actually has made us a much stronger system. It's wonderful to be able to talk about not only the pride, but the accomplishments of this organization. There are very few organizations that have been 5 times Magnet winners. And I think we can all learn from the pride and performance of this organization. But we're all focused on being part of the fabric of the communities we serve. And you can just tell from the comments that precede mine how people know and are part of the community, and that really makes a difference in addressing the care needs of the people that are our friends and our neighbors that we're caring for every day. The transformation of this space and other key spaces on the campus are going to just enhance the care of your friends, your family, and your neighbors. So let me turn it back to Leslie. Thank you.
Thank you, Joanne. It's my honor to introduce Senator Welch to come up and say a few words. Thank you.
Thank you very much. Kathy, thank you. Joanne, Tom, thank you. I'm just got a beautiful day here. I'm just thinking about what it would be like to show up in the emergency room to this beautiful building and then have the Lantern Award winners smiling, ready to take care of me. I mean, I'd be halfway better before I got in your door. I really appreciate it. Senator Leahy has done a lot for this hospital. I just want to acknowledge him as well as Senator Sanders and Congresswoman Ballot. But this project is all you. I mean, this was all the community. And, you know, there's a couple of things that this brings to mind for me. Healthcare is such a challenge now, you know, the structure of it, the cost of it, the competing, complicated, and oftentimes conflicting financing mechanisms, everything that leaders have to do to try to essentially keep in place a really good staff, make sure you get the training you need, deal with labor shortages, deal with totally irrational payment systems and little control, even though this is an incredible community resource, not an immense amount of control over what the costs are and not any control over what the patient needs are. It takes an incredible commitment to serving the healthcare needs of the citizens, because the process that you have to go through is very, very tough. And I just want to acknowledge that to the healthcare leaders and to the board, that this is really, really tough. But the other thing that I also am mindful of is that COVID was brutal. And, you know, all of us, if we step back, remember how we had to make these huge adjustments in our life and how destabilizing it was that your kids couldn't go to school, how destabilizing it was that you couldn't necessarily go to work, but you did it because it's what we had to do in order to try to be as safe as we possibly could. But there were some folks who, when the guidance was, don't go to work, went to work. And it's the folks right over there. So every one of them, the Lantern Award winners, had kids at home trying to figure out what to do. How do they do their homework? How do they deal with the social isolation that was so much part of it? How do they deal with the risk of being out and about where that highly communicable disease was waiting for you, and we all feared that? But they had to come here, and they had to work. And they did. And I just think that all of us have to, whatever our own challenges were with our own families and our own personal situation, I really acknowledge the extraordinary debt of gratitude that we have to our healthcare workers, to our first responders, to our public safety folks. So I, on behalf of all of us, want to express my gratitude to the work that you did. You know, but the third thing is really a celebration about how in this community there's a commitment to the well-being of the community. And that's from the donors, it's from the labor force, it's from the board. You know, I see the Marrows here, and it's so good to see you. And I loved your book about Bennington at war. And that book reminds me of Bennington today, where these kids in high school suddenly were flying, they were flying bombers over Europe. And it was everyday kids. They were out on the farm. They were buddies. They knew each other. And some of them made it through the war, some of them didn't. But a lot of them came back to Bennington. And that kind of spirit that they had, you do the duty. It's a war, it's COVID, whatever it takes, whatever the challenge is, that's the challenge you face. You do it. And in a deep way, you don't necessarily know why, but in a very profound way, it's because you have been the beneficiary of others who came before you that had a deep dedication to the well-being of Bennington. And all of you who have made the impossible achievable with this extraordinary improvement of the emergency department facilities for people showing up who are desperate, who are scared, who are seriously injured, who have loved ones, who have an immense amount of anxiety, and you have this facility with these trained people whose job it is to make that person better, to reassure their loved ones about the situation with the person they so deeply care about. That's what binds us together. So whatever the challenges are, Bennington Strong is Bennington being there for people who are in need. That's all of us, by the way, okay? That's not just an income deal. All of us need the strength that a community can provide to give us a sense of place and well-being. And you're doing that here today. And for me to be invited to share in this reinforcement of that tradition that Bennington has had to its well-being through thick and thin is quite an honor. So congratulations to you, and thank you so much for allowing me to be part of this glorious day.
Thank you, Senator. That was wonderful. I now want to ask Jill Maynard, the director of our emergency nursing team, to come up and say a few words, and then we're going to have the ribbon cutting.
Okay, cover your ears. There we go. We've got a little height issue here. Hi, good afternoon. So I think that many of you have seen me before, heard me talk before. I acknowledge that I am what stands between cutting the ribbon and eating, so I'm going to be very quick, okay? I just have a few words here. So first of all, I want to thank you all for being here. What a gorgeous day. I stand over there. So I've worked here at the hospital for 20 years, and there are many reasons I'd never go anywhere else. But I stand over there today and I look at the community that's come together to support our hospital, to support our team, to support our clinicians, and you don't find that in a lot of places. You don't. You walk through the hallways and you know people. Everyone talks to you. They see you in the grocery store, and it's like you're old friends. And so it just really hit me as I was standing over there, just the sense of community that we're so honored to have here. So I want to thank you all for being here. Special thank you to Don and Nancy Kendall for spearheading our new emergency department, but for everyone who has supported, donated, given their time. You've contributed to this project in innumerable ways, and you've given a gift. So this gift isn't just an emergency department. This is a gift to our community. This is a gift to our organization. This is a gift to our team, our staff, our clinicians, our providers. The safety net, the ED is like the safety net of the community, and I know Tom touched on that a little bit, but when you need care, the only place that's always open is the emergency room. And so what this new emergency department does is it gives our top-notch emergency team a facility that they can continue to give back to the community for the years to come with high-quality care. Many of you saw the old space. It was outdated, it was small, it was impossible to efficiently do the work that we need to do quickly. But this new space gives us that ability. It gives us private rooms so that patients' information stays within that space. It gives us more space. Our equipment actually fits in the places we need it to fit. We have advanced technologies now that allow pertinent medical information to flow right from the bedside into the medical record. It can be seen by all of the care providers. There's no reason to run around with a piece of paper and hand off a patient's vitals to somebody else. You can see it. All of that stuff leads to safer care. It's provided us the ability to have negative pressure throughout. So we learned in the pandemic that there were things that our healthcare facilities were not equipped to handle. And though we're sort of in this phase of COVID where it's kind of just become part of our everyday life, we don't know what is next, and something will be next. And we're now ready for that. We're equipped to handle that. It's created collaborative workspaces, so our physicians, our advanced practice providers, our nurses, they're all working in one space together now, as opposed to separate areas or in nooks or crannies where we could find space to put a computer. That enhances collaboration, communication, quality of care, and in turn safety. When you have nurses and physicians that can speak very quickly in one space, they have the ability to deliver safer care. And one of my most loved portions of this new ER is our emergency crisis area. And I know many of you have had the ability to tour that. We know that there's a demand for mental health services, but there is not enough inpatient beds or outpatient resources to meet that demand. Therefore, the patients have been boarding in emergency rooms, waiting for care to be delivered in a setting that meets their needs at the time. These are vulnerable patients. Could be any one of us on any given day. They're in crisis. They're having some sort of challenge, or they need medication stabilization. And many facilities just keep them in hallways of their emergency room. It's loud, it's overstimulating, it's unsafe. There's nothing to help provide them comfort or care. So our new emergency crisis area allows us to do that with natural light. We've integrated technology, so we're the second hospital in the United States to integrate a technology system called the Cohen system, and it basically gives the patient back control. They have the ability to do activities and provide information to the clinical team through a device in their room that's safe. They can't harm themselves with it, they can't harm us with it. And through the creation of this new emergency crisis area, we have decreased the utilization of restraints by over 60%. So those of you that aren't in healthcare, one of the most dangerous things that we do in the emergency room is take over control of somebody's body through the application of a restraint. So anything that you can do to avoid that provides safer and more therapeutic care to a patient. So to be able to decrease that by 60% by introducing a new education program for the staff and a physical environment that is designed for healing when you're in crisis. We've been able to do that, but none of that would have been possible without everyone here contributing and supporting that work. And so by being able to give our clinical team this facility, we're going to continue to see improved outcomes in the years to come. So Tom touched on it a little bit, the Lantern Award. I'm going to touch on it very briefly. So the Lantern Award was something that we set out years ago to try to achieve. It got waylaid by many things. It's not an easy process. You have the Lantern Award is a national recognition to emergency departments that use evidence-based care and innovation to improve the quality of care, the safety of the care, and a very important piece, a healthy work environment. And so it doesn't just look at what are you doing for your patients, it's what are you doing for your staff. And so by being able, the Lantern application in itself is quite a process, but our clinical staff stepped up and said, we're ready, let's do this, we want to participate. We had to show outcomes and initiatives that tied back into the quality, safety, and the healthy work environment. So why am I so excited about the Lantern? Well, one, because we're the first hospital in Vermont to achieve it. There isn't another hospital in Vermont, New Hampshire, the capital region. We're one of 94 in the country. But we did this through a pandemic where staff were coming to work, putting their life on the line. We did this through construction. Now, through construction, we maintained 100% capacity in our ED with no agency staffing and no shutdown of clinical space. And so that's really, it's an honor to not only be in a Lantern facility, but to see all of the things that we struggled with, yet we were still able to do it. So that is a testament to those standing over here, the clinical staff. They've been instrumental in this. They've showed up every single day despite the jackhammering, the shaking of the floor, the new wall that now impedes their ability to go to the break room or use their restroom. And they showed up every day and said, all right, we're a family, let's do this. And they did it. And so I hope as you go tour through the space, you are able to see how beautiful it is, but also the pride that the staff are really taking in that. So thank you so much.
So I'm going to ask Tom and Kathy to come up, and we're going to do a little celebratory bearing of the time capsule.